Regeneron is the medicine that we're here to talk about today. It is a medicine offered under an emergency use authorization by the FDA, which means it's not fully FDA approved yet, but it is still in the testing phases. It's being approved for emergency use because of the severity of the pandemic, and it does have some initial safety and effectiveness data to be given to the general public. The medicine works by targeting the COVID virus spike protein. This is the protein that the virus uses to get into our cells and make us sick. And this medicine is a collection of antibodies that binds to those spike proteins and inactivates them so that it can no longer make you sick. It does need to be given within the first 10 days of treatment in order to be effective. And your doctor will talk to you about whether you qualify for that during the discussion later on. Regeneron is a medicine that works kind of similar to the vaccines. It is not a replacement for a vaccine, but if you do get sick, if you're vaccinated or unvaccinated, this medicine can be used to help you get better from COVID. The benefits of Regeneron are mainly that it prevents severe disease. They showed in the study that they completed for Regeneron that it was able to decrease hospitalizations by approximately 70% in patients that received Regeneron. It doesn't take away all of your symptoms. You can expect that they will be lessened and that you will improve a little bit faster. But the main point is to try and decrease your chance of developing severe disease, defined as the need for oxygen therapy, which would lead to a hospitalization. And that is effective out to 28 days. The possible side effects of Regeneron, don't worry, there's not too many. It is, of course, possible to have allergic reactions. That's what everyone's worried about when they get a new medication. But this medicine has shown to be fairly safe. In the initial study, they had 13,000 participants, and there were only 2 reported allergic reactions. At the recording of this video, Lee Health has given about 1,600 injections, and we have had about 2 reported allergic reactions, and they were mild, and the people went home the same day. Other symptoms reported for the Regeneron infusion were very similar to the COVID virus itself. So things like fever, chills, nausea, vomiting, loss of taste and smell, and those are all attributed more to the virus itself, not to the treatment. Other potential side effects include the possibility of infusion site reactions, because it is either an infusion or an injection, and because we do use a needle to access the vein, that can cause pain, bleeding, or bruising, but that's very uncommon and, in my opinion, not a reason to refuse this medication. It is also possible that you could have a post-infusion reaction, and this happens in about 1/3 to 1/2 of patients. It's very hard to predict who this will happen to, so we try to educate every patient about the possibility this could happen, and it's not a concerning problem as long as you can control the symptoms. So the post-infusion reaction generally comes on about 3 hours after you getting the medication, and what patients experience is a slight increase in their symptoms lasting for a few hours to maybe overnight. So I usually tell people that day 0, or the day that you got the infusion, may be a little bit more uncomfortable, but on subsequent days you feel better and better and better. The medicine to use for these symptoms would be mainly Tylenol, and if it's safe for you to take according to your other medical problems, you could also use ibuprofen. It is safe to take those 2 medications together, but you should always take ibuprofen with food and not on an empty stomach. Regeneron is administered one of 2 ways. From Lee Health, we currently have the option of getting an IV infusion. This is a medicine that would be given in someone's vein, in their arm through an IV, just very similar to getting a bag of fluid or IV antibiotics. The alternative method of receiving this medication is at the health department injection site, and they would be giving the same medication with the same total dose spread out over 4 different injection sites, 1 in each arm and 1 on either side of the belly, or 1 on either side of the buttocks, all at the same time in order to complete the treatment protocol. All of these treatments are completed in one event. So if you receive the infusion from Lee Health, it is completed in one event. You're not treated multiple times. And if you're treated at the health department location, you get all 4 injections at one event. The infusion does take about 3 hours to complete. The medicine itself is infused over 20 to 30 minutes. However, the time to set up and get everything ready and then monitor you afterwards totals about 3 hours. The injection site clinic is currently taking about 2 hours to complete because it takes time, again, to get set up. To administer the injections is fairly quick, and then we monitor you for an hour afterwards as well at that location. I like to describe what I call the immune consideration of the medications, and this is basically how you deal with a vaccine if you do get this medication. Because this medicine is so similar in appearance to the body, to the vaccine, you need to be cautious. If you do get this medication, you're recommended not to get a COVID-19 vaccine for 3 months or 90 days. It's not that it would hurt you to get the vaccine early, but because it looks so similar, you would get a suboptimal result from the vaccine. Additionally, if you are due for a booster shot after getting this medication, I would still advise you to wait 90 days before getting your booster shot. Again, because the booster shot looks so similar to the Regeneron, we want your body to get the best reaction possible from the vaccine or the booster shot, so I would wait the 90 days. If you choose to not receive this medication, you can still be vaccinated, and the recommendation at this time is to be vaccinated 2 weeks after you're feeling better and recovered from COVID. The only contraindications for treatment would be if you do not want to take the medication. We're not going to give it to anyone who does not agree with the treatment. Additionally, if you are requiring more than your typical oxygen, or if you are not usually requiring oxygen and COVID is causing you to require oxygen, then that would indicate that you've progressed to severe disease and you would be treated in an emergency department or in one of our local hospitals, and we would assist with that transfer and treatment. Regeneron does show to be safe for patients with kidney disease, and we have treated patients who have kidney disease all the way up to end-stage renal disease on dialysis, and they have tolerated it well. Regeneron is not well studied as of yet in patients with liver disease, but similar medications in the past have not hurt people's livers, and Regeneron at this time is assumed to be safe for patients with liver disease. Let's talk about the cost of the medication for just a moment. Regeneron at present is paid for by the federal government and shouldered by the taxpayers, so this medication cost will not be passed on to you for the medicine itself. If you are treated at Lee Health, there is a possibility of receiving a cost for the act of the infusion, and that's dependent on your insurance, your deductibles, and your copay for the year. If you do have any questions, the best answer is to get scheduled and call your insurance company to ask for the copay amount for treatment with Regeneron. Now, if you are treated at the injection site from the state clinic, there is no cost associated with that. That is completely paid for by the state government. I would like to answer some frequently asked questions that I have been asked over the past few months while administering this therapy, and then you can ask any further detail or questions to the telemedicine provider whenever you get on the call. So again, this is a single treatment, a single infusion, or a single series of injections. You should take all of your home meds as normal on the day of the infusion unless there's another reason. There's no need to adjust for this medication. You're not being enrolled in a study by taking this medication. This medication does not change your quarantine period. You stay in the quarantine until you're symptom-free for at least 3 days. There's no incentive for physicians or providers to get you to say yes for this medication. There is no pressure from Lee Health to take this medication. The medication does not impair your ability to drive, so as long as you're safe to drive to the visit, then you're considered safe to drive home as long as nothing changes. Because you're COVID positive and it's hospital policy, you're not able to have any visitors during the infusion. We do have several infusion centers where you could be treated. It's advised to take the first available location. We do have a center in Cape Coral, down in Estero at Coconut Point facility, and then up at the main hospital at Lee Memorial. For those of you that need it, there is Wi-Fi available so that you can occupy your time while you're waiting for the infusion to complete. And for Lee Health employees that are being referred for this consultation, I do like to point out that there is no pressure from Lee Health to take this medication. Just because you're referred from Employee Health does not mean that you need to take this to return to work, and it has no bearing on your work status at Lee Health. This is simply offered as a treatment just as it would be for anyone else. So this is one of the more difficult parts of this conversation. Your doctor has referred you over because you are pregnant with COVID-19. I like to advise patients to do some reading on their own in order to try and satisfy your own questions, and the best place to get additional information is from the ACOG website. ACOG stands for American College of Osteopathic and Gynecologic Physicians, and this is the premier place to get information about pregnancy and pregnancy-related problems in the United States. We have discussed this treatment with the local obstetrician groups, and the general consensus between information from what is available on ACOG and the local groups is that if COVID is trending worse in a pregnant patient, the recommendation is to consider treatment with monoclonal antibodies. Now this does come with the caveat that there is no formal testing for pregnant patients, and that is not likely to be a study that is discreetly completed because of the nature of pregnancy. However, if we weigh the risks and benefits, it is best to choose the lesser of two evils in some cases. And if you're getting worse with COVID, we do need to protect you and the baby from increasing complications related to COVID itself. So the position of the local physicians as well as ACOG is to recommend that if there is progression towards severe disease, to consider monoclonal antibody treatment. It is generally considered to be safe, but there is no discrete data, again, to prove that it is safe. I know there's no way to take away all the fear of receiving a new medication, but we need to weigh the risks and benefits between worsening COVID and Regeneron. And I do want to let you know that we have treated patients who are pregnant and COVID positive. They've tolerated the medication well. So the goal is to prevent worsening COVID, especially if you have multiple risk factors that make you high risk according to the EUA associated with pregnancy. Those people do have worse outcomes. So the recommendation is to consider treatment. I would like you to take the time to go on the ACOG website, and the easiest way to find that, Google ACOG Regeneron and look for the frequently asked questions page from the ACOG website. They have information about pre and postpartum care and associated questions with COVID-19 illness all through pregnancy. I would encourage you to read there and satisfy your own concerns before accepting treatment. When you get on the telemedicine call, the provider can try and answer any additional questions you have, but another option is to discuss as well with your obstetrician before moving forward.